Hello everyone. My name is Dr. Sonia and I am a consultant ophthalmologist at Kartik Nethralaya Eye Hospital, Bangalore. Today we have with us a very senior glaucoma specialist, Dr. Manogna.
Hello.
She is a senior glaucoma consultant at Kartik Nethralaya Eye Hospital, Bangalore. And today we are going to clear a few of our doubts about something called as glaucoma. You might have heard about it, but let us understand today what it is. So Doctor, hello,
Hi,
welcome.
hello.
So first of all, just for our viewers, please tell us what is glaucoma.
See, most of the times when I tell the patients that they have glaucoma, the first question I come across is what is it? They don't even know what the condition they already have. So glaucoma is a disease which affects your optic nerve. So this is how your eye looks. This is the nerve which is the center of your retina. It connects the eye to the brain. So it is a disease of the optic nerve which progressively damages this nerve and causes you the field loss. Okay.
So the glaucoma is different from cataract. Sometimes they get confused between glaucoma
because both
and
the conditions we see in elderly people mostly. So when we say glaucoma, they usually ask, is this cataract? So it's two different things. Cataract is the one which comes in your lens, which is a natural lens which becomes opaque, is cataract. Glaucoma is condition which occurs in your optic nerve, which is the nerve that is there behind your lens. Okay.
So who are the people who are at risk of developing glaucoma?
Okay. The most commonly it is seen in an elderly population, usually above 40 years of age. As your age increases, the risk increases even more. But it can come at any age. We have something called as congenital glaucomas also, which occur in children. We have juvenile glaucoma, which occurs in adolescents. So all kinds of age are more vulnerable, but more than 40 is the most common age group for it. And second, if you have a family history, suppose if you have a sibling or a relative who is having glaucoma, then you are at 10 times more risk for getting the same disease. So it's very important that you know your family history. If anybody has the similar problem, you should get screened for the same. And third, it's more common in diabetics and hypertensives. So if you have any comorbidities, you should get an yearly eye evaluation. And most common other cause which most people don't know is steroid usage. Steroid usage in any form can increase the eye pressures and can lead to glaucomas. It can be in the form of skin creams, it can be in the form of inhalers or tablets, or any form it can increase the eye pressures and cause glaucomas.
Okay, so how does one person come to know that whether they have glaucoma or not? Like what are the symptoms or signs?
Okay, the first thing when I tell the people they have glaucoma, they is like, I don't have any problem. Why do you say I have a disease? That's because it's a silent killer of your vision. It is completely asymptomatic. Until the last stages, your center vision remains absolutely fine. So you doesn't know that you have it. It first affects your side vision, and gradually by the end stage when it reaches the center vision, it is too late for us to treat you. So you should get your routine evaluation, during which we will pick it up. There will be some signs in the eye, like your eye pressure will go up. There is something called as cupping in your optic nerve that we can see. These are the few early signs which we can pick up, and if we can diagnose it early and treat it early, we can prevent this visual loss.
So like is there any pain or anything like that happens in glaucoma?
Usually there are two types of glaucomas. One is open angle and other is a closed angle. Open angle, basically in glaucoma what happens, the area which drains the fluid from your eye, it doesn't drain it. There are two reasons why it doesn't drain. One, the area will be open. This is the area which I was talking about. It's called the angle of the eye. Normally in some people it will remain open, but it doesn't filter the fluid. That is the open angle types. This open angle type of glaucoma usually is completely asymptomatic and the patient doesn't know he has glaucoma. And other is the angle closure type. In this, the space is filtering normally, but the space is narrow. Okay, so when it's narrow, you will have few signs, especially like pain in the eye, redness in the eye, and colored halos. Colored halos means whenever you see a bulb, you see color halos around it. So this colored halos, and in addition to that, when the pressure is very high, you will have acute signs like headache, vomiting, gastritis, nausea. All this also will set in. So these signs are seen in only angle closure type of glaucoma. This is a very it's also an equal component, but most of the glaucomas like open angle glaucomas are silent. So it can present in either way.
So we don't know.
We don't know, yeah. Maybe in more than 60% of the population, they don't know they have.
Okay, so when suppose a person comes to you and you feel that there is a glaucoma, there is a chance, there is a suspicion that there may be glaucoma, then how do you test those people? What
Yes.
all tests are done for that?
Yes. First, it's usually picked up during your routine evaluation, so which is a compulsory for people above 40 years. So during your routine evaluation, we'll look at your eye pressures. So normal pressures inside your eye between 10 to 21 millimeter. So anything more than 21, if we see, we'll get a suspicion. And second, there will be few signs in your eye, like your optic nerve. There is something called as cupping, which can increase, and there are few other signs during which we can get a suspicion, which has to be evaluated further. So as I told you, there's a damage in the optic nerve. So there's a OCT scan of the optic nerve which can pick up that damage and tell us the extent of the damage. So that is one test we usually do. Second, we'll do a field test. So as I told you, glaucoma first affects your sight vision. So we want to know how is your sight vision. So this visual field test what tells us the extent of the damage that has happened to your field. Okay, so that is some compulsory, we will do that. And third, as a routine evaluation, we'll check pressures for everyone. And fourth, we have to check your corneal thickness. Cornea means the front transparent portion which you see is the cornea. So once the corneas are thin, the pressure can be come low, then actually what is there. So this is called as falsely low. So because we have to have a correction factor for that. So that is the reason we compulsorily do corneal thickness measurements for all the glaucoma patients, which will help us to know actual pressures in their eye.
Okay.
These are the few tests we usually do.
You will see how the passage is, whether it is blocked or
Yes,
open
yes.
with gonias.
Yeah, that is one thing I wanted to tell you about the glaucomas next. So as I told you, two types of glaucoma is there. One is open angle and the closed angle. So what is the type of glaucoma, we'll get to know in that test called as gonioscopy. In this gonioscopy, we'll put anesthetic drops in your eye and we'll put a lens on top of your eye. So in that lens, we will see the drainage area, how it is, what are the changes that are there, is it narrow, is it open, all this we assess. So if the angle is open, usually the treatment is in the form of medical management, and if the angles are narrow, usually we prefer a laser which will open the angle so that there will not be any permanent closure that can happen over there.
Okay, so after the laser, do they need further treatment?
Yeah,
or?
so depends on the type of glaucoma and the extent of glaucoma. Sometimes already few permanent changes would have occurred in the angle which cannot be reversed with just the laser. Then we would manage them medically, and if medically also if it's not getting under control, then we go to a surgical management.
Okay, so doctor, what is how much is the importance for the medical management? Like how important is it to put the drops regularly? Can you tell us a little bit about
sure.
that?
So in glaucoma, most of the management is actually medical. So it's very important that you put the drops properly and you use them regularly and as per prescribed timings. So most of the patients we treat come back because with high pressures because they have not used the drops properly or they have not instilled the correct timings. So it's very important that you know the technique and know the timings also. So usually if this is your eye drop, you open it. Before putting the drops, you should thoroughly wash your hands. Open the cap. Just drag the lower lid, take the support of this hand and instill one drop.
Can you show on this?
So drag the lower lid, instill one drop and close your eyes and apply pressure here. After you instill in both the eyes, apply pressure here for 2 to 3 minutes. This pressure is very important because there is a tube that connects the eye to the nose. So as soon as you put the drops can escape into your nose and throat, and sometimes this can cause you systemic side effects. And also the efficacy in the eye also can come down. So by instilling these drops and closing and occluding your, this is called as punctal occlusion. So by doing that, you are making sure that you don't have any systemic side effects, and also the efficacy of the drops inside the eye will be better. So this is how you should instill. And regarding the timings, there are different kinds of drops. A few other drops which can act only for 12 hours. Few can act only for 8 hours. Few can act all 24 hours. So what is the dosage of the dosage and timing of the drops will be decided by your treating doctor. So if it has to be used once in the night, then you use it like that, and around the next day you try to maintain the timings so that all 24 hours you will have some drops that is acting. And if the drops is divided for 3 times, they will tell you the timings also. You should put accordingly. Suppose if you have 3 or 4 drops that has to be instilled, so you divide them in such a way that all around the clock there will be some action of the drops. Suppose if you are going to get up in the morning by 5 o'clock and you sleep by 12 o'clock. So when the doctor starts prescribing you medicines, he will ask these timings to you. So if one drop, suppose something like a Cinca drop has to be used 3 times, he will divide in such a way that you start with morning 5 o'clock, put it afternoon 3 o'clock and night 11 o'clock. And another drop which is there, which has to be put only once in the night, you put it at 8 o'clock. So that way there is a proper and equal division of the drops, and there is equal distribution of the eye drops also.
Okay. So this was about the medical management, but do they need surgery also for glaucoma?
Yes, there are three kind of options for glaucoma. One is medical management, second is laser, third is the surgery. So medical is most of the time we try to manage it medically if it is under good control. If the pressure is under good control with the drops, we ask them to continue the same. There are some times where the putting drops would be difficult. Why? Because the patient is not compliant, is not regular with the follow-ups, he is allergic to most of the drops. Sometimes even when he is putting the drops, his pressure is not coming under control. During such situations, we go for a surgical option, or another we also have a laser options, but the lasers are temporary. So if we in these lasers we do laser to the drainage area so that the drainage will increase. But the problem is they are temporary, they can act only for 3 to 6 months, and again you would require a laser once again. So if you are looking for some permanent solution, that would be surgery. It's called as filtration surgery, which is trabeculectomy. This is the trabeculectomy is the most preferred surgeries in a primary glaucomas. Primary glaucoma means without any other disease in the eye, you have only glaucoma. That is primary glaucomas. In this, we usually prefer this trabeculectomy kind of surgery. There is another group of glaucomas called as secondary glaucoma. Secondary glaucoma means secondary to some other disease in the eye, you have developed a glaucoma. So in that, we prefer some other surgery known as the valve surgery. So what is the best option for you? Your doctor will decide after looking at your condition and the cause.
Okay, so like suppose somebody has undergone a surgery, does this make them free of drops, or they still
Yes.
have to
See, most of the patient ask me the same thing. How successful would be the surgery? See, it is difficult to tell the success of a glaucoma surgery. Say if you say cataract surgery you take, we can tell that the results are like this, they are 100%. But the success rate of glaucoma surgery is usually 70 to 80%, and it does decrease with time. In glaucoma surgery, what we do is we create a passageway here for the fluid from inside there to go to the outside. So this drainage area is an artificial passage. So over a period of time, I will try to close it. So there will be some healing process that occurs. So the efficacy will not remain the same all around your lifetime. So some people it might filter very good, some people it might not filter so well. So whether you would require drops after surgery or not, we will be able to tell you only after the surgery, depending on how much drainage is occurring from this area. Okay, some people might require 3 months later surgery, some might not require a whole of their life. So that we cannot guess it.
So even if you have undergone a glaucoma surgery, you will need a regular follow-up for your glaucoma.
See, despite of what is the condition, whether you are being treated medically with laser or surgery, you require periodic follow-ups. It is like having a sugar. If you have sugar, you have got sugar, you don't leave it like that. So you regularly follow up your sugar levels. This is the same condition. You have to regularly get your pressures checked, get your nerve checked, and how frequent would be the follow-up will depend on the severity of your condition.
Okay. So one more very common question which people ask, that okay, I'm putting the drops or I've undergone surgery, is it going to reverse me back to normal?
Yes. Most of the patient, when I tell this is the problem you have, that they will ask, is it curable? I would say it's not curable, but it's definitely preventable. Okay. So what is lost in glaucoma is lost. We cannot bring it back in any which way. That's because it's a damage in the nerve. Nerves, once they are lost, they will not regenerate whatever we do. So what we can do is we can diagnose it early and prevent further progression. We can keep your condition stable so that it doesn't progress further and cause further visual loss. So whether it's worsening or not, we don't know. So that's why you need to follow up regularly. So whenever the condition is worsening, we have to step up our treatment to prevent further worsening. That's how it should be.
Okay. Any other message you want to tell your glaucoma patients?
Yes. See, prevention is always better than cure. So we cannot cure this condition, but definitely if we can diagnose early and treat it, we can prevent a permanent blindness which can impair your healthy lifestyle, impair your family and everything. So please, if you are above 40 and if you have any of the risk factors like family history of glaucoma or high minus powers, or if you are in steroid usage for any form, then please make sure that you get periodic eye checkups, get treated for glaucoma, and come for regular follow-ups.
Okay. So I think doctor has very nicely explained to us about glaucoma. If you have any kind of questions, please feel free to contact us anytime. Thank you so much. Thank you, doctor.
Thank you.